Guys, are we really doing this? Barbie waist, ant waist, wasp waist, whatever you call it, plastic surgeons are now creating bespoke corsets by literally fracturing ribs and making the waist smaller. So let's break it down, literally. Before 2017, some surgeons were actually removing ribs, the 11th and 12th ribs, or the floating ribs, to shrink the waist. Alfred Hoyos, who is a very well-known and respected plastic surgeon in Bogota, Colombia, called this approach risky, warning of serious damage to the lungs and specifically breathing. Another surgeon, Dr. Kazbek Kutsev from Russia, called this mutilating surgery, saying it violates medicine's first rule, which is to do no harm. So he designed an alternative. Instead of removing the ribs, he breaks them. He drills little holes into the ribs and then he bends them until they crack. It's not a full break or fracture. It's what we call a green stick fracture. So it's a partial fracture. And then he makes his patients wear corsets for about 2 months while they heal in a new position. And if you think this sounds like a horror movie, it's real. It's now being marketed as something called Barbie waist, and it can cost up to $8,000. Most patients are having this procedure done in under 10 minutes. They're having it done awake, and then they are being placed in corsets for 2 to 3 months. The reality is that the waist is one of the hardest areas to contour. Fat, we know, can be sculpted, but bone defies the frame. And that's what surgeons today are trying to reimagine. And look, as a plastic surgeon, there is value in pioneering new techniques. Innovation is how medicine evolves. But this particular innovation, we are very far from mainstream acceptance. We don't yet know the long-term impact. We don't have good safety data, and we don't know if patients are satisfied long-term. Just like any other innovation in plastic surgery, time will tell if this becomes an accepted evolution in body contouring or a cautionary tale. Let me know what you think.